Greetings. I'm Dr. Robert Wiechmann, Chair of Cardiovascular Surgery at Mayo Clinic in Eau Claire, Wisconsin. Today I'll be discussing minimally invasive valve surgery, myth versus fact. Traditionally, cardiac surgery has been done through a mid-sternotomy incision, where we make a long incision in the middle of the chest and divide the breastbone. That operation has worked very well. It's safe. It gives us excellent exposure of the heart, but it certainly comes with a cost. It's painful. The recovery time is often prolonged, 3 to 4 months, and there's always the risk of sternal wound infection, which is a devastating complication of cardiac surgery. More recently, we've been doing our isolated valve surgery through a minimally invasive right chest approach. We began our minimally invasive valve surgery program in 2007. And to date, we've done over 400 minimally invasive valve surgery procedures, and we've been teaching surgeons from around the Midwest our techniques. Minimally invasive valve surgery is typically done through a right chest 6-centimeter incision. We do not divide the breastbone, we don't divide a rib, and the recovery time has been fantastic. We're able to do aortic valve surgery, mitral valve repair and replacement, tricuspid valve surgery, as well as a number of other less frequent procedures through this minimally invasive right chest approach. What are the advantages of minimally invasive valve surgery? Well, certainly the incision is smaller and there's a smaller scar. There's significantly less pain, less bleeding, decreased length of hospital stay. Most important, decreased recovery time. Our patients can often get back to normal activity in 3 to 4 weeks. We avoid dividing the breastbone and therefore avoid the risk of sternal wound infection. We see our patients have improved lung function after surgery, improved cosmesis, and the psychological benefit of not having a sternotomy is significant. This slide really demonstrates the dramatic difference between a sternotomy incision to do cardiac surgery and our minimally invasive right chest incision. Who's a candidate for minimally invasive surgery? As I mentioned, we're now doing nearly all of our isolated aortic and mitral valve surgery through this minimally invasive right chest approach. If patients have significant coronary disease, they're not often a candidate for minimally invasive surgery. We have been working closely with our cardiologists to do minimally invasive valve surgery and have our cardiologists stent isolated coronary lesions. But in general, if people have significant coronary disease, in addition to their valve disease, they would continue to require a sternotomy. Thank you for joining me today to learn more about minimally invasive valve surgery. If you'd like more information, please see the information below.